I'd like to announce PanElla 2, which is the Visible Women highlighting she in health. Our speakers are already here. We have a stellar lineup of people, of doctors actually, who have been doing fantastic work in Pakistan and abroad. And I can't wait to share, what they have in store for us. I'm quickly going to just remove this and welcome all of you. I'm filling in for Mehak over here, but we can start the discussion right away. So Dr. Bushra Anjum, I'm going to start with you. Dr. Bushra Anjum actually has global experience. She's joining us from the US. People were asking us why we're doing this event at night, and we said, okay, we have someone joining in from the US. She is a PhD and a health IT data specialist, currently working as the data analytics manager. And she works very closely with analysts, scientists, and engineers working on product and client-facing analytics. We have Dr. Sara, who is the person behind Sehat Kahani, and her organization is built on the work from home culture way before it became a pandemic trend. And we'll hear more from her and all the work that they've been doing, especially during COVID, when it's become such a huge challenge for people to go out. And Dr. Ayesha Mian, who I also know in a personal capacity, she was one of those people we always used to look up to when I was a little girl. We're actually related. And it's an honor to have her here. She's the immediate past chair of the Department of Psychiatry and the founding dean of students of the Office of Student Experience at Aga Khan. And she has a lot of global experience. She's, I think, moved to Pakistan a couple of years ago, and is a distinguished fellow at the American Academy of Child and Adolescent Psychiatry. We'll hear more from her on her leadership, mentorship, and service by various organizations. And with that, I'd like to start our panel. When we talk about choosing science subjects, many women and girls limit themselves to, their options to just MBBS or pharmacy-related fields. And not that there's anything wrong with that, but the world of science has evolved so much. And just right now, when Nishat was talking about everything is science, the way we live and breathe is science. We have so many more disciplines than ever to choose from. And right now I have 3 women, who are really championing this field, but in a variety and very diverse at the same time. So Sara, I'd like you to start. Sehat Kahani was built out of the idea that, Pakistani women don't get the opportunity to work outside of their homes because of, various domestic or other issues. If you'd like to start with that and how you have been highlighting she in health way before it became a trend,
So thank you, Aqsa. I'm really glad to be here today. I'm a personal fan of Dr. Ayesha. She knows that. And I'm really glad to meet Dr. Bushra as well. Thank you so much for inviting me to this. I love PanElla, the word. Totally in love with it. So Sehat Kahani is about making connections between a huge force of female doctors who unfortunately miss out from the working force in Pakistan. Majority of our medical workforce is made of female doctors, almost 70% out of 200,000 doctors. But unfortunately, only 20 to 25% of these doctors actually work, and rest become a term that we commonly call doctor brides, that they have a degree, but they don't practice, and they choose between their family and their career, or they're made to choose. That impacts the whole health ecosystem of Pakistan because it's a huge population. We have a lack of doctors, and when majority of the workforce does not work, half of our population does not get access to a qualified doctor. They might see a quack or a midwife, but they don't see a qualified doctor. And that becomes worse in rural or low-income communities. So through a personal experience, a very random, incidental personal experience, I being at home, started providing consultations through a phone call in a clinic I used to work in around 4 or 5 years back. And that just propagated the idea that, if I can do it from home, why can't all female doctors that are sitting at home and are not able to work in and outside Pakistan due to various factors, children, home duties, they can't afford daycare, etc., cultural issues, why can't they just all start working from home, and at least we can provide a doctor consultation to patients using on-call or online consultations. And we started with on-call consultations, later turned to video consultations. And a simple idea of taking a nurse's clinic in a low-income community, upgrading that clinic, teaching her a software, and using a nurse in a community to connect the patient to an online doctor. Starting with 1 clinic is now present in 35 clinics in all 4 provinces of Pakistan. We later evolved into also making a mobile app version that is available to a more commercial market, to corporates and to retail individual users as well. But I think the main essence is that all these doctors who were trained, we never thought that we sitting in a place like Karachi can provide consultations in Khuzar, Balochistan, or a doctor sitting in Kashmir can provide consultations in Multan. And that is all possible because of the power of simple technology and the power of internet and the idea to teach that to a local community staff. And I think that's what Sehat Kahani does, and that's what we do, and that's what we've done to 340,000 patients so far.
You're mute, Aqsa.
Aqsa, you're muted.
Sorry, I said, so you were obviously talking about technology and how it's absolutely critical to your business model. I'd like Dr. Bushra to sort of take this on because you look at the data and analytics side of health sciences. What is that like? What's the scope like for women who want to sort of enter that field?
Absolutely. Thank you so much for inviting me to the panel. And just like Dr. Sara said, I love the word PanElla. Whoever came up with that, that's great. So as you rightly said, that there are a lot of opportunities here and a lot of opportunities in general in the health field that go beyond MBBS or pharmacy related degrees. As you rightly again said, that there is nothing wrong with that, but sometimes we don't look beyond the obvious. And for that, if I may take a slightly different take on that about the career choice, what happens is, unfortunately, in our society, many parts of our society, though it's changing, is that we don't want we would like our daughters or sisters or wives to conform. We don't want them to stick out too much. So we would like them to stay within the norm so that they are not someone who people look at and say, okay, why isn't she following the norm? What's wrong with her? So that sometimes become a motivating factor of going towards MBBS or related pharmacy degrees because it's socially acceptable, it's very respected, it's even desirable. And then there are tens of thousands of women who have done it before you, so you're not really deviating from the norm. You have role models, you have guidance, you have established career options. And they are all good reasons to choose that field. My point would be that if you want to go into the medical field because you really want to go into the medical field and serve the people that way, that's excellent. Do that. But if you are doing this because it's the socially acceptable option, then I would encourage you to look around and see what other options are available for you. So as Dr. Sara has started by saying that the entire work from home culture, which is becoming more and more prevalent around the world, and that involves internet, that involves software, and that involves data. So if you want to go into the technology field, any field related to computers or computer science or data or statistics, then that also gives you an excellent opportunity to serve in the overall area of health IT. I particularly work for a startup in San Francisco. It's called Doximity. So that's a closed network only for doctors and nurses. So you can imagine it like a LinkedIn or a Facebook, but it's closed. So only doctors and nurses who have a registered NPI can join that. So since that's a closed network, it allows the doctors and nurses to have various conversations there that they cannot have over like a text or an email. There are laws against patient data and privacy. So the channels are limited where you can have that kind of conversation. But that platform, because it's closed, it provides that opportunity. So that allows doctors to make referrals, subspecialty referrals to for their patients, connecting to doctors in other parts of the country and their field or their related fields. And also we try to make sure that the medical literature that's out there, whether it's research-based literature like journal articles or organic articles, they get routed to the right doctors, right physicians. Pharmaceutical news get routed to the right physicians. New drug news gets routed to the right physicians so that they can remain on top of their field and know who to reach out to and what to read and how to stay on top of things. So that is one area which is becoming extremely popular these days. That how to enable our doctors to perform better, how to enable our doctors to have a wider reach, how to enable our doctors to know what's the latest in their field so that they don't have to consult 30 different websites or journals. They could go to a single portal and get that information. There is plenty of opportunity out there in this area, and I'll be happy to talk about it more too, but I want to be respectful of time.
Because you're working with a network of just medical professionals. I'd like to take the conversation to Dr. Ayesha and have you talk about the institutional environment, because a lot of your work is obviously involved in gender equality in careers and advancement in science, medicine, and global health. So if you could take that front.
Great. So thank you, Aqsa, for having me on this. This is wonderful, and I'm loving ElleTech. And I was going over the webpage this morning, and kudos to you to sort of putting this together. So well done with that. A couple of things based on what Sara and then Bushra said, and then I'll move on to your question. So one, Sara mentioned that it's just a simple technology, just hum use karke ye keh rahe hain. But I think that one of the things that women don't own up, and Sara should own up, is that there was also this brilliant idea that took root in a person's mind, in a woman's mind. If there was a male sitting here, he would have said, I thought of this great idea, and look where we've come up to. But we don't do even what's called graceful self-promotion, which kind of keeps, so because we don't do it ourselves, I think we need to have our group of comrades that do it for us. So I think that piece is very important, to kind of own the fact that there was this great idea. Not every woman who may have taken a phone call and checked up on some patients would have said ki ye sabke liye karte hain. This can be taken nationally and internationally and stuff. And I know, and I'm sure Sara would agree, that there are a lot more stumbling blocks that come in the way of women as they put something like this together. So kudos to you, Sara, and I think that this is important for us to be able to own that this idea sort of was germinated and has, mashallah, sort of taken root in such a big way. And also, Bushra, you spoke about conforming, and I think that's the other piece that we get so bogged down into roles that conform to certain ideas, and this is how it should be, and that is how it should be. And as we break out, not just as little girls thinking ki doctor ke alawa bhi kuch ban sakte hain, nurse ke alawa bhi kuch ban sakte hain, it happens at every stage of your career. It happens like every time so now that I am non-conforming and saying that, okay, I'm now going to be leaving academia, there is significant and would be a significant amount of pushback on that, right? And it's going to be, so at every stage when a woman kind of decides to leave the coop and say, or leave the patriarchal mindset or the tribal mindset and say, ki ab mujhe yahan se nikal ke thoda sa kuch different karna hai, there is going to, and this is internationally, this is not just Pakistan. I think that piece needs to be owned up and taken up by a lot of very courageous women who are doing really brave stuff, and then keep speaking about it, because it's important. What I realized at some point is that at this point, I was getting very tired with a lot of things that were going on, and just feeling like I'm constantly fighting against one hurdle and another hurdle and another. And I said, okay, I'm going to just not do this anymore. I'm just going to step down and stuff. And somebody said that there are a lot of younger women who are looking at you to kind of see how you do, and if you sort of give up, then that would be like, dekhiye, Dr. Ayesha bhi nahi kar saki. Right? Not that it's like what I'm doing, but it's the same things happening with Sara, same things happening with Bushra, same things happening with a lot of women, that, a lot of younger women are looking up and saying, look, if she can do it, then I can too. And that gives them a lot of sort of, it becomes the wind under their wings. So I think that piece, again, is very important for women to not just do things that are different, but also talk about it, come out and kind of say, and talk about the problems that come up. Kind of failures aaye, ye issues aaye, stumbling blocks aaye, yahan gire, yahan masle hue, yahan logon ne mujhe ye kaha, wo kaha, but then this is how I dealt with it and kind of moved on. And then have this sort of little community of practice of women that are doing this kind of work, so you can, sit and do that. So institutionally, again, that was one of the reasons. I mean, gender was never something that was on the top of my mind. I'm in the area of mental health, and I'm in the area of child mental health. When I came to Pakistan, that was about 7 years ago. Do ya teen child psychiatrists the pure mulk mein. So I'm like, I need to go develop a training program and create this idea of youth mental health and child mental health. So focused on that. But when I came, of course, I realized that mental health overall, he itna zyada problems are. So, focusing on that, and I can use this word here perhaps, but, our first retreat that we had with our department was developing a strategic plan for the department, was how do we make psychiatry sexy at AKU, right? How do we make it attractive? How do we make it, and that's the idea that, how do we break away that stigma and say, okay, this is cool too. It's okay to have depression or anxiety or this and that. And I'm a very private person, but I put myself out there saying, look, this is what psychiatrists look like. We're not kind of these old, crazy people that logo ke dimag mein hota hai, but this is what mental health experts can look like. We also have families, we have kids, we
live a real life. Yeah.
That sort of stuff. But then also, as I started as chair, I became, I started sort of the Office of Student Experience. And that's when I kind of came across my glass ceiling that, there are issues that, this is upsetting people, or I'm breaking that norm, and I'm beginning to feel that there are, concerns that come up, and at an institutional level as well. And I don't think that it's, AKU had anything to do with it or anything. I think globally, this is such a big problem that there's the leaky pipeline, and then there is the sort of glass ceiling that you get to. And that is when I kind of moved into this idea of, looking at gender equality, but specifically, health mein bahut women hai. So nursing is full of women. 98 health and education is all about women, but it's the, as they say, that it's served by women, but it's led by men. Okay, so why is that the case? Why are we not leading? If you're serving, then why are we not leading? So where's the problem with that? And that was a question that sort of started coming to me, and I felt that AKU was a good platform to start talking about that. And I did my own, sort of went to the US, did a whole women in leadership program to kind of understand leadership. Some of the things that we shy away from, hame budgets achhe nahi lagte, hame finance acha nahi lagta. Hum numbers dekhte to be like, what is this about? And then of course this promotion, like how are we owning what we are doing and kind of gracefully promoting ourselves and putting ourselves out there. Just may issues, and again, because when we do it, we are aggressive, or we are bitchy, or we are not nice women, versus men do it, that's the way. There are lots of things that come up that I think it's important for women to come together to talk about, so that we can slowly. And my sense for that is that gender equality needs to be institutionalized. It needs to be put into the design of any organization you become a part of. अगर आप उसको छोड़ देंगे ना कि नहीं हम मेरिटोक्रेसी पे चलते हैं, हम सब अच्छे, तो फिर वो unconscious bias आ जाता है. You will take more men, you will. But if we say 30%, 40% of our women in leadership at every stage are going to be women, then you will make it happen, right? You will actually make it happen. So that's my sense for that.
So Sara, you've been, working with an all-women team, even the development side of things and the execution side of things. What's the journey been like for you? Because obviously, when we're highlighting she in health, maybe I don't know, male doctors have probably approached you guys 1,000 times to come up on board, and you're like, okay, hold on, we set the rules here.
So I think, yes, we do work with some male doctors because there are certain specialities for which women doctors are not available, or there's a cultural hindrance where a female might not talk to a male, or vice versa. But 99% of the organization is women doctor focused, women nurse focused also, because all our nurses in communities are females. All our coordinators in our clinics who handle the clinics have turned to be females. I think it's an interesting journey. It's very challenging as well. Being a female boss in a country like Pakistan is not easy for people to digest. Having 2 female bosses and a 90% leadership team who is female have not been easy. There have been instances when I was taking interviews and I've been asked, and I was, I think, 6 months pregnant with my second one at this time, that, aap CEO hain, interview aap lengi. And then I walked into so many investment conversations, so many corporate conversations in which literally I was once told that next time you come in, bring someone elder into the conversation, जो बड़ा लगे. So that my response was कि अम्मी को ले आती हूँ, मतलब इसके अलावा तो कोई बड़ा नहीं है मेरे पास. But I think there's a general persona of a female in Pakistan that she can't be the boss, she can't be the one handling finances, she can't be the one giving orders. And if it is a woman like that, she'd be very manly and very aggressive and have like this manly demeanor. So it is very interesting. It was very challenging in the beginning, and different types of people respond differently. So how you talk to bureaucracy is very different. How you talk to government is very different. How you talk to corporate circles is very different. How you talk in the community is very difficult. So I think there's so many roles that you have to play, and so many guards you have to be. So many guards have to be let up at all times, so that people take you seriously. People know that you know your work. When I used to go into investment conversations in the beginning, I just could feel that people thought I did not know numbers, and that propagated me into learning more, into preparing more, into knowing my pitch exactly how it is. And I actually used to practice my tone of the pitch before going into investment meetings. So I've experienced all that. But I think what also I love is 90% of my execution team, the operational team and the head office is women. And I've seen that women, if you give them an opportunity, they own it like anything. They are loyal, they put in 100%. When I take interviews now, I see young girls coming up and saying, "Hum sab kar lenge, hame bas aap mauka dein, let us prove ourselves." And I don't see that much in men, but I'm not trying to be gender biased, but I do see this urge for women to prove themselves, especially the younger ones who are coming out. And they really put their heart and soul into their work. And it's nothing's more special than seeing a woman, than having a younger woman and groom her and make sure that she realizes her full potential and actually gets to do it. There's so many women who are afraid of traveling when they come to our company. वो कभी कराची से इस्लामाबाद नहीं गई हुई होती, उनको उनके माँ बाप को कन्विंस करना पड़ता है कि let them go, it is okay, they will survive, we will make sure that it's secure, but let them be. And once they pass that bridge, once they know that they can do it, they excel like anything. So I think as women, we sometimes are really scared to take that first step, or people around us are very scared. They want us to be cocooned in a certain box and not let us out of it.
The way it serves them, perhaps, yeah.
Yes, but I think once you let out that shell, I've realized that women have a lot of potential. Whatever we are, whatever the company is, it is because of these awesome women who have come together in nurses and doctors, in our coordinators, in our volunteers, in our team, who've shaped it into what it is now. So I think that's phenomenal, and I've really enjoyed it, and I won't have it otherwise.
That's really endearing to hear. So Dr. Bushra, I'd like you to talk a little bit, because you sort of have this progressive team structure where you have domain experts and researchers sitting alongside data scientists and data engineers. Can you share a little bit about some of the lessons learned there, and maybe some of the challenges that you've been breaking down those barriers?
Yeah, absolutely. I'll start building up on what Dr. Sara has said, that it's difficult to be a woman in a leadership position, not only in Pakistan, unfortunately, world over. मेरे research professor थे lumps में, well, he's still in lumps, Dr. Zartash, and when I was about to go to the US for my PhD, he said that don't expect too much from people. अगर पाकिस्तान में 5 गधे हैं तो बाहर 3 होंगे, लेकिन गधे हर जगह होंगे. So I still remember that phrase of his. So it's being a woman and being in a leadership position, and then interacting with other people, especially males who have been in their fields or in their positions for quite a bit, is difficult. And then being a woman of color, as we say here in the US, being from South Asian descent, or any other, even if it's the Latina descent or African descent. So you look different, you don't look like a white person, and then that brings its own set of biases. And then English is not our first language, so that brings in its own set of biases. So all of that combined, it's an interesting journey. Many of the challenges that women, whether they are working in Pakistan or abroad, they are going to be same. Maybe the techniques to deal with them will be slightly different because they will be dealing in different cultural contexts, but the problems are similar. So if you step up in a career, if you step up as a professional woman in Pakistan and you are doing good, even reasonably well, I can assure you can do well in any part of the world, because the barriers in Pakistan are still stronger than they are in other parts of the world. So if you are in your professional field in Pakistan, I say do look at the opportunities available to you internationally. You will do really well. You're already trained for this. As far as the field, my field is concerned, so हमारा जो काम होता है data side पे, it's primarily on 4 different fronts. One is the predicting the spread, whether it's any disease. So उसमें network science आ जाती है, econometrics, applied microeconomics, machine learning, data science, so predict how some certain thing is going to spread. Second is spatial distribution, that whereas in the first one we were looking at the disease itself, in the second one we are looking at the population groups. Which population group might be more vulnerable to that disease? Which population group might need more resources? How to effectively reroute the limited amount of resources available. थर्ड मेन एरिया आ जाता है इफेक्टिव ट्रीटमेंट्स का, तो उसमें भी आप जीन सिक्वेंसिंग आ जाती है, कंप्यूटेशनल बायोलॉजी, algorithms to try various therapeutics, antibodies, and figure out the best medicine that could be made available for that particular disease. And the fourth one, which is kind of my favorite and least favorite at the same time, ये हमारे वक्त का तोहफा है, digital misinformation. There is so much digital misinformation in any area, but especially in health. Vaccines के बारे में लोग अजीबोगरीब बातें कर रहे होंगे जिन्होंने कभी मेडिकल कॉलेज का शक्ल भी नहीं देखी, या जी इसकी डिसमिनेशन के बारे में बात कर रहे होंगे कि ये तो हो ही नहीं सकता, या इसके पीछे तो कोई there is ulterior motives behind this particular drive, and it's not about health, it's more about some political aspirations or anything like that. तो वो इतनी misinformation आ जाती है on various social media websites that we need a conscious counter effort that people in computer science or people in data can lead, and they are leading worldwide, especially for COVID. COVID आए तो ऐसी बातें आई कि पता नहीं क्या आप प्याज खाएं तो उससे COVID नहीं होता, or things like that. I mean, I can't even go into that. So to looking at all that information, figuring out which one is misinformation, tagging it correctly and countering it is a whole other field of data science, which is becoming more and more prevalent, especially as related to the health field.
Thank you, Dr. Bushra. I'd like each of you to sort of make a comment about, really reshaping economic development through empowerment of women in science. The whole concept of this event was based around, International Day of Women and Girls in Science. And if each of you can just leave a comment about, the economic side of things, and of course, inclusivity is something that all of us have talked about. So you're on mute. Just a second.
Sorry.
Yeah.
Okay. So, one of the things that has happened with COVID is I was just in another call just before this, and I was quoting this, that for every one man who's leaving the workforce because of COVID or who's had to leave the workforce, 13 women have left the workforce. Okay. So this is a big problem. US they've actually marked it as a major issue, and they have hashtags called "Please come back to healthcare" or "Come back to healthcare" because so many women are leaving the healthcare workforce. I think जब भी कोई इस तरह का pandemic, so overall Pakistan अगर आप देखें तो gender, and Sara might be able to tell you a little bit more about it, but gender equality index पे हम I think आखिर में ही है, we are like the second last or the third last. We've got a really, really bad gender index. And just economically, if you think about it, if you're 50% of your population, which is our women, are not working, look at that loss. I mean, it's just mind-boggling to kind of think about. And the kind of, Sara alluded to it, the kind of work that women are ready to put in, the kind of dedication, the kind of motivation that they're ready to put in, free of charge, जो घर में कर रही होती हैं, और again अपनी families को sustain करने में कर रही होती हैं, if they're able to sort of get into the economic workforce, then a lot of our issues that we're having right now would just easily change. So I think that there is no I mean, we can talk about the moral sort of grounds, equality honi chahiye, the ethical grounds, the whatever, all of these things. But at the end of the day, just show people data and money, and then say it financially makes sense. Get that right. So I think it's important to think about it. But of course, in our culture, you've got to do it in a way that Sara's kind of gotten to it. You just can't go out and say patriarchy is horrible, because patriarchy is integrated into our very souls of women as well, mostly in women. Forget the men, right? It's completely integrated into the culture. So when you slowly kind of make those changes, you show role models, but then you also sort of give them an opportunity that doesn't seem like, okay, we're ready here to threaten men's space. We're actually going to help you get that opportunity in your own space. अगर आपको घर पे रहना है, आपके बच्चे हैं, आपके ससुराल है, आप नहीं निकल सकते, तो आप घर पे ही बैठ के करें. So coming up with these kind of creative ideas and models, which I'm sure there are many, to kind of allow this to sort of move forward, I think is the way to kind of move this forward.
If I can just add to what Dr. Ayesha was saying, I think for me, one thing that really hinders economic inclusiveness of women is the 9 to 5 work culture in Pakistan and the office culture in Pakistan. That work can only happen in 9 to 5 in an office environment, because it is not a possibility for women, and it's not a possibility for a lot of women post COVID. Because who's going to take care of their children? Who's going to take care of their house? Because we've all, have seen lockdowns and areas where we
Yeah.
don't have domestic help.
Yeah.
So I think for us, we have a lot of women who work offline. Our quality assurance lead is from Lahore. Our data and research analysis lead is from Karachi, but they both work offline and they're not required to come to office. And majority of their work happens from 10 a.m., 10 p.m. at night to 4 a.m. in the morning, because that is when their kids sleep. And that is when they get time to work, and they put in excellent work. So I think one thing that we can change is going from the time culture to the KPI culture. That, okay, they need to complete certain KPIs, let's measure them against that, and not for the time they put in. Because even now, when a woman leaves office early in certain categories of work, especially in the law field, maybe, eyes get raised in the business field and the law field. But women have to leave office if there's a parent-teachers meeting, if there's a child who's sick. Who's going to do all that? So once we start normalizing work from home, paid work from home, and actually normalizing it into DNA of organizations, you see a lot of more women joining in at flexible part-time hours and working maybe more than a full-time employee.
Absolutely. I think COVID might have made your case a tad bit easier, but I hope that, that sort of stays, Dr. Bushra, if you'd like to make a closing comment on this.
Certainly. I think one of the things that I must highlight is the effort that communities like ElleTech is doing, because it's a very famous saying that you can't be what you can't see. Agar aap envision nahi kar sakte कि it's a possibility, so it's become difficult to you to actually pursue it. So for example, someone earlier might have said that, okay, entrepreneurship तो शायद ख़वातीन के लिए होती नहीं है, या अगर entrepreneurship हुई तो शायद वो कुछ import export कर रही हैं कपड़ों का काम. But no, entrepreneurship is a very real opportunity, like Dr. Sara is doing, and even in the fields like service-based fields like health.
Yeah.
So it's really important to bring out all these different career options and all the women who are working in it out there as role models, and for people to make themselves available to us, answer any questions. So my closing thoughts will be that if you want to take a road less traveled in your career, take a road less traveled. There will be communities out there where you will be accepted, supported, and cheered for, just like ElleTech.
Thank you. Thank you very much. Is there any closing comment from either of you before we wrap up this session?
So I'll just add, the one thing that I've had to learn is one that sometimes I feel like women have a hard time to do. When you're out there and you put yourself out there, you've got to develop a thick skin. Okay. And I think that piece is very, very important for young women to realize very quickly, that it's okay for people to say, you're horrific, you're not good, you're messing up this, or, this is one of the things that I've struggled with, is always that anytime somebody gives me something, they say, all right, karne do Ayesha ko, what's the worst that will happen when she fails, right? So us chakkar mein mujhe cheezein milti hain karne ko, because I'm trying to nudge boundaries and I'm trying to be a change agent. So this is a new thing. So people are already expecting women to kind of fail or not do okay. And they will say things. So I think that piece is important. Men have become good at it, I think, just in terms of evolution, because they've been in the workforce for such a long time that they have that sort of thing. And I think it's important for us to develop that. And then also just to be brave and be courageous and just get out there, make mistakes, fail, perfectly okay to do that, come back, get going, because that's the way, things will start rolling.
Absolutely. Sara, is there anything you'd like to say before we close?
So I think one thing I tell my daughter is that, I have two girls. So my older one, she's 7, and she's always asking me, Mama, you do this, you do that. How do you you manage so many things? Are you going to a meeting? So I keep telling her, you have to do this. I have to do this so that you do it, and you have to do this so that women after you keep doing this. Because we have to keep challenging people that work can happen even when a woman has a household, even if she has children, even if she has other responsibilities, she can still work. Because with everyone else around her, I think my main responsibility is also nurturing and caring for myself and also growing myself. So, do as many as many courses, as many educational institutions you can go to, as many career opportunities you can take. Whatever comes your way, just grasp it. Because as Dr. Ayesha said, the worst that will happen is you won't be able to do it, but at least try. And that's something that I've really followed in my life. कि जो हाथ में आ रहा है उसको पकड़ लो. Do not let any opportunity go just because you might be a housewife, you have children. I'm not asking to deprioritize, but one thing that I've seen as a woman is you always learn to multitask and you always learn to prioritize when it happens. So you won't be losing on anything, but just grab opportunities, don't be scared, and then you'll see that you'll be able to manage.
Absolutely. Thank you very much. Thank you, Dr. Sara, Dr. Ayesha, and Dr. Bushra for sharing your valuable insights with us. I hope all the girls watching this take something back home with them. And just thank you from each one of us at ElleTech, and we hope to stay connected. Like Dr. Bushra was saying, people always need communities, and they'll find them if you just get out there. We hope to be there for all of you. Thank you once again, and we'll now move on to the second part of our session. Thank you.
Thank you, Aqsa. Pleasure being here. Thank you. Thank you. Bye-bye.